Hey guys, happy Friday. It's Dr. J here in the house. I'm doing a live Q&A here on my YouTube channel, justinhealth.com/YouTube. Feel free and subscribe. All right, let's dig in. Any questions here, feel free and write in on YouTube or on Facebook. Hope everyone is having a phenomenal day. All right, what's happening in the functional medicine world that you guys want to chat about or address? What's up? Let me know. Look forward to addressing everything. Hey, Spivey, hope you're doing well. All right, so a couple of questions here regarding muscle twitching and muscle cramping. So when we see any muscle twitching or muscle cramping, the first thing we think about is electrolytes, of course, right? So we're making sure we have adequate levels of sodium. Where do we get sodium from? Ideally, you're going to get it in a lot of junk food, right? But we also want to get high quality sodium in like a good sea salt, whether it's a Celtic or Himalayan or a Redmond's real salt. That gets you a full spectrum bit of minerals. The next is adequate magnesium, about 600 to 800 milligrams a day. There's different kinds that are out there. You know, the chelated versions tend to be better absorbed. And then potassium would be next. You know, we like about 4,700 milligrams of potassium a day. What does that look like? That's about 6 servings of green vegetables, maybe a serving, 1 whole avocado, and then a serving of squash or a sweet potato. So that gives you enough potassium. So then we get the sodium covered, we get the magnesium covered, we get the potassium covered, and then typically the calcium, about 1 gram or 1,000 milligrams a day will get you enough on the potassium side. The X factors outside of that are just making sure you have enough stomach acid to be able to ionize your minerals and to break everything down for maximal absorption. And then, of course, making sure there's not like an infection that will prevent the absorption of a lot of these nutrients as well. Hope that helps. Hey there, Rowan. Hope you're doing well. Let's keep on digging in here, guys. Is it more important to fast for 14 to 16 hours or to eat within 30 minutes of waking up? So it just depends, right? A lot of people that have blood sugar issues, where they're, let's just say they have a lot of adrenal issues, a lot of mood issues, a lot of anxiety, maybe some fatigue. I think starting your day with good blood sugar support, meaning healthy proteins and fats, does a lot. Number one, people that are waking up in a stressed out state get a really high amount of cortisol, and we don't want that cortisol to be breaking up tissue. I'd much rather have amino acids in your bloodstream that your body's using for fuel and gluconeogenesis than taking up tissue. So if you're more stressed, your body will always pull out the expensive bill. Or, imagine if you're in debt, right? You're always going to cut the expensive bill first. And let's address the issue, but muscle's an expensive bill. You need adequate rest, you need adequate stimulation, you need adequate nourishment to keep muscle on. So that's going to be burnt up pretty fast if you aren't having enough nutrition in there. So in general, I think the timing of the meal, especially if you have blood sugar issues and adrenal issues, is really important. What are symptoms of Crohn's disease and how do you test with a colonoscopy, how to treat it? Well, I mean, there's like 2 major types of irritable bowel disease, IBD. There's going to be Crohn's and ulcerative colitis. There's a couple other subsets in there, but in general, Crohn's and ulcerative colitis. Ulcerative colitis primarily at the end of the colon, usually a lot of bleeding, autoimmune, right? Or if that's ulcerative colitis, and then Crohn's kind of has these skip lesions. So it's they kind of the inflammation kind of skips usually from the small intestine to the large intestine, and usually the major diagnosis is going to happen via like an endoscopy where it's visualized and seen. But in the end, why someone gets Crohn's or ulcerative colitis is going to be genetic predisposition, right? One of the big factors we see with any Crohn's or ulcerative colitis condition is calprotectin, right? Calprotectin is a protein produced by the white blood cells in the gut in response to inflammation. So the more inflamed your gut is, that's going to activate your immune system, right? 80% of your immune system's in your intestinal tract. So the more your immune system is activated, it's going to just suck up a whole bunch of energy. Right. This is why when you eat bad food, you get tired. When you get sick, you get tired because your immune system sucks up so much of the resources of energy. And that's a common side effect. Your last podcast talked about fasting. I noticed that when I fast, it's hard to get 3 meals a day, particularly with waiting 2 to 3 hours before drinking water. Well, number one, you don't have to wait 2 to 3 hours before drinking water. You can drink water about ideally, 10 minutes before food's fine. Probably even fine if you're 5 minutes is probably okay if your digestion's relatively okay. Now, regarding the fasting, I mean, it just depends what kind of a fast you want to do. I think most people can do a 12 by 12. Let's say they stop eating at 7 or 8 p.m. and their first meal's at 7 to 8 a.m. That's usually pretty reasonable to do every day for most people. And then you have simpler ones like a 16 by 8, where maybe you eat at 12 noon, at 4 or 5 p.m. and then 8 p.m., right? That gives you 3 meals. Again, the biggest issue I see with people in the fasting community that are so pro fasting is it's hard to get enough nutrition if you're doing 2 meals a day. And it's nearly impossible if you're doing 1 meal a day. I've seen this many times a day. Just go do an exercise, run your foods through chronometer and see how much nutrition you can get in with 2 meals a day. It's pretty tough. Now, the anecdote that most people that are super proponents of fasting say is, well, there's a lot of stored nutrition in your fat. Well, there's stored calories, right? Fat's a very dense source of calories. 1 gram of fat's 9 calories. I don't think, from what I understand, fat is a storage source of vitamins, minerals, bioflavonoids, electrolytes. It's a dense source of fat. It is what it is. So you need to get those other nutrients from food. So if you do 1 a day, it's really hard. Now, maybe you're a genetic freak and you have amazing digestion and you can eat a 3,000 or 4,000 calorie or a 2,000 calorie meal and process it all, fine. Most people are going to need at least 2 meals to get adequate calories. I mean, if they need 2,000 calories of whole food a day, they're going to need at least 2 meals of 1,000 calories each to get, whole food nutrition, right? Healthy fats, healthy proteins, the right amount of carbs for them. All right, next question here. Let me roll in. Wow, they are piling up. Okay, here. Dr. J, do you ever use the tartar to add extra potassium? I do not, but there is something called new salt that I will use from time to time. It's a potassium chloride salt to get extra potassium. And then I use a product by Trace Mineral Research called Endure, which has some potassium, it has some sodium, it has some chloride, it has some magnesium, and it has some sulfate and calcium too. How does cocaine affect the brain? Well, cocaine is a stimulant, and primarily what it's going to do, it's going to jack dopamine up. A lot of people that do, whether it's something like an extreme sport or whether it's sugar or cocaine or like a methamphetamine, they're primarily jacking their dopamine up. And dopamine is that like happy kind of reward center neurotransmitter. So we want to be able to choose constructive vehicles because, drugs like that are going to have deleterious effects in the long run with destroying parts of the brain. We much rather increase the brain neurochemicals with herbs, with nutrients, with amino acids, much safer, more constructive way to do it. How much water would you recommend consuming upon waking? I try to drink about 32 to 48 ounces, but it tends to take like an hour and a half, which isn't always the best. I think that's a lot of water personally, but I would say, I'd say 2 cups. I would say 16 to 24 ounces is reasonable if you can do it. You shouldn't feel totally uncomfortable. So I would look at probably decreasing that water consumption a bit. Kay Gupta writes in, what's your take on taking spirulina overall for health to clear acne? I mean, spirulina is kind of like an algae, right? It's like a kind of an algae kind of thing. There's some great effects with it binding to various things. It's a good binder. It can bind to metals, mercury, for instance. So I see it helping on the binding side. So if there's a lot of dysbiotic critters, it may bind things up, but it probably is not going to have an effect on killing any of this bad critters in your gut that may be causing some of your skin issues. Genesis writes in, why does broccoli give me massive sulfur-based gas all the time? After eating it, years of no issues. What are your thoughts of sulfur-based SIBO? Well, broccoli is a FODMAP. It's a higher FODMAP, so it's a fermentable carbohydrate. All right, what's a fermentable carbohydrate? Fermentable carbohydrates are fructo, oligo, disaccharide, mono, and polyols. These are just fermentable carbs. A lot of FODMAPs are actually really good for you, but if you have SIBO or a bacterial overgrowth, the bacteria will feed on a lot of these fermentable sugars, and this can be the result. There's a lot of gas and bloating, right? Typically, more methane-producing bacteria, you get more constipation. More hydrogen-producing bacteria, you get more diarrhea. So that's why if you have SIBO, cutting down some of the fermentable carbohydrates can help starve some of the critters out. But you may have to go on an herbal protocol where you actually knock out a lot of these critters with berberines or golden seal or silver. And then if you have SIBO as well, more than likely your digestion is going to be weaker. So your enzyme production is going to be lower. Your hydrochloric acid production is lower. So then you're not quite breaking down all the good fats and proteins you're eating. James writes in, why is it bad to add in fats and carbs together, like butter on rice cake or butter on bread? Well, primarily the reason why is because if you're jacking insulin up really high, your body gets into a storage mode. So insulin's a kind of a storage hormone, right? So bodybuilders will use it after a workout because they want to get a whole bunch of amino acids into the muscle. So they use it to build up the muscle. It's anabolic for getting the muscles up. The difference is a lot of people that aren't active and aren't lifting, their insulin's going up. They aren't really active, so they aren't really doing much. So then all that fat that kind of comes in with whatever they're eating and the carbohydrate tends to go right into the fat cell. So that's why doing a whole bunch of bad fats or a whole bunch of even good fats with a whole bunch of carbohydrates, if you're not that active or you're more insulin resistant, could really increase your fat storing situation. Hamid writes in, hello, doctor. I have a problem of burning urine. What should I do? Could be a UTI issue. You can get a microscopic urinalysis to see what's going on. I mean, my big go-tos for any UTI issues is you can juice 8 ounces of organic cranberries a day, 4 ounces in the morning, 4 ounces at night. You can also do D-mannose, which is an undigestible sugar that tends to glom onto the E. coli. E. coli is the big bacteria that tends to cause UTIs. And then also silver. Silver is excellent as well. Really helps knock things out. Let me head over to Facebook here. Hey, Stephanie. I woke up with painful Charlie horse over the night. My calf was actually sore the next day, weight bearing until I stretched. It's a sign of dehydration, low electrolytes. I'm day 27 of a whole 30. Oh, awesome. So great job for doing the whole 30. I would look at electrolytes. So the first thing is, if you're unsure of mineral status, you can always just run your food through a chronometer. It's a free app, CRONOMETER, and just make sure your minerals look good. So I think I mentioned earlier, 4,700 milligrams of potassium a day is good. That's really important. A lot of people don't get that. Number 2, about 600 to 800 milligrams of magnesium is a good start. Those are the 2 I think people miss. And of course, you can just use good quality sea salt as well. But in general, if you do that, you'll be in a good place. You can also do the new salt, NU-SALT is a great way to get extra potassium in there. And then you can always just get an extra avocado. It's about 1 gram potassium. That'll help a ton. All right, cool. Let me head back to YouTube here. Gabe writes in, assuming I have low stomach acid and I forgot to take enzymes, just had a big meal, how long will the food sit in my stomach for? Can I speed up the digestion? Well, typically food sits in your stomach for about 1 to 2 hours. And if you have something called gastroparesis, it means the stomach is going to be really slow in how it empties out. And typically there's a low stomach acid environment, low enzyme environment there. That's why the food's sitting there. So there's natural things you can do called prokinetics to help, like ginger's a really good prokinetic. There's a couple other things like chamomile or gentian. Those help. Hydrochloric acid and enzymes also help get that food digested and get it moving on. Remember, we need a nice low pH in the stomach. If we don't have a low enough pH, then the food tends to sit there longer because the body wants to release all that chyme in the stomach into the small intestine when the pH is a little bit lower, because that triggers the gallbladder and the pancreas to work. And the gallbladder produces a whole bunch of bile to break down the fat. The pancreas produces a whole bunch of enzymes, whether it's trypsin or chymotrypsin or various lipase enzymes to break down the fat and the protein as well. Okay, here, next question here. How do you heal an old lumbar compression fracture, 1 year old? Fell off, no accident or fall, just pain. Arthros, osteoporosis, spinal stenosis without operation, chiropractic care. So in general, if you have a back issue, you want to get to the root cause of the issue. So if there wasn't an acute issue, then it's obviously more chronic. So usually if there's a chronic issue, there's going to be instability in the joint. The joint's going to be unstable. And what tends to happen is the surrounding muscles that are your natural shock absorbers aren't working. So then all that force goes into the avascular, right? Avascular means tissues that don't have good blood flow. If tissues don't have good blood flow, it tends to be harder for them to heal. So you want to get the muscles turned on that are in that surrounding area, in the back and also the hip area and the glutes. And that's important. That way those muscles will help absorb force. You may need some kind of decompression support, whether it's a chiropractic technique that does it or some at-home stuff to help really open up the disc so it can suck some of that disc back in if it's popping out or bulging or protruding at all. And then, of course, like anti-inflammatory herbs are going to be great. Like curcumin or boswellia or frankincense. And then you can always do systemic-based enzymes, which can be taken away from food. These go into your bloodstream and they digest a lot of the interleukins and cytokines that may be part of that whole inflammatory response. And of course, the good building blocks, right? Collagen peptides are going to be important. 50% of your bones are actually protein. So having a good collagen matrix from these amino acids will be super helpful. But you got to get to the root cause in any type of spinal stenosis of the instability, the inflammation. You got to get the joint moving good again. You have to get the surrounding muscles stabilizing again. It's like a tent. Imagine if those surrounding poles started to collapse. The tent just starts to fall in on itself. And that's what happens with a lot of people with chronic back issues. Matt writes in, my wife had recently injured her foot from trail running and has an ultra marathon coming up. We were putting on frankincense, peppermint, ginger oils, perhaps some magnesium oil, anything else. Yeah, I would do collagen peptides, and I'd also do systemic based enzymes, like a serapeptidase kind of thing. Will using water peroxide in my water pick or disrupt my gut flora? Um, Again, if you're using hydrogen peroxide, I'm guessing you should just be flushing with that. I wouldn't be drinking that. I mean, we're talking like 3% hydrogen peroxide. I gargle with that in the morning. It's my natural teeth whitener. I like that stuff. It's cheap and it's good. What's your favorite sea salt? I like the Celtic, but I don't know. There are good ones out there. I like the Redmond's real salt. I think it's just very soluble. It breaks down into water really nice, and you don't see a whole bunch of granules floating in there. So I like the Redmond's real salt. All right, I got to jump on another podcast. I'm interviewing Dr. Brian Moles here in just a bit, guys. 2 more questions. All right. Can too much water cause loose stools from the body dumping extra into the intestines? Well, if something's inflammatory in there, the body will pull water in to dilute whatever the inflammatory compound is. That's what basically diarrhea is. Why do I always wake up in the middle of the night gasping for air and my heart beats fast as hell? Well, it could be a blood sugar issue. Could be a drop in blood sugar in the middle of the night. So I'd have a little bit of protein and fat before bed, maybe a little bit of carbs. That would be helpful. You can also play around with the adaptogens during the day and before bed, like a holy basil or ashwagandha. And then you can put like some kind of a good protein or fat-based bar on your nightstand. That way, at least gives you some protein and fat in the middle of the night. So if your blood sugar is dropping, that'll help. Rico writes in, I have an L4, L5 herniation with severe sciatic pain. For the past 6 weeks, I started walking on crutches 2 times a day. Doctor scheduled cortisone injection, PT to build core. Any thoughts? 20% of the population, their sciatic nerve actually goes through the piriformis. So I would really get a good active release chiro or a good myofascial release massage therapist to work on the soft tissues in that area to make sure that sciatic nerve is not being pinched out by those surrounding muscles there. Do you really have to work hard and persistent to have sex? Have success? Yes, you do, of course. But you got to work smart, not hard necessarily, or both. Ideally, I try to work both. When dealing with fungal cleanse, is it normal to get uncontrollable stools or Herxheimer's? You can. You just got to taper into it, use some binders and such to mitigate a lot of these things being liberated. All right, guys, I got to jump on another podcast here. Hope you all have a phenomenal weekend. Enjoy yourselves. Take care. Bye.